in the African American community. For a long time, there's been a lot of people, you hear people talk about African Americans not getting mental health treatments. Rates are lower in the African American community, but actually, rates are about the same. It's just that there's some disparities with African American treatment that come into play. So, in the African American community, the U.S. Office of Minority Health did a study in African American adults were actually 20% more likely to report mental health symptoms. However, the continuation of outpatient treatment does not meet those same rates. So what that says is that African Americans may identify some things, but they don't stay in treatment or continue with treatment. And there are several factors that come into play when we think about that. Societal issues. We think about socioeconomic status. A lot of people who come from a more high class have been introduced to therapies and mental health at a younger age, so it's a norm to them. In the African American community, it's not really a norm or understanding. So there's some a lack of understanding and misinterpretations around mental health that kind of hinder those in the African American community. It's not what I saw my mom do. It's not what I saw my sisters do. They don't talk about it at school, although I know that I'm going through this. The lack of financial ability to get services is one thing. There's more African Americans who are uninsured in America. So that's one of the factors that goes into the disparities within mental health in African Americans. Then there's all the homelessness, the societal thing. So in the African American community, there's much more trauma. There's much more things going on in social issues that impact their abilities to address mental health. So if I'm worried about me having some place to stay, I'm worried about me having money to feed my kids, my mental health is not always the number one priority right then and there. So, and then also the culture of the African American community. Many know that the African American community, we've coped through a lot of things. We've dealt with a lot of things, a lot of pressures. So the misinterpretation that mental health shouldn't be addressed. We can handle it. We can cope through it. You just have the blues. So that's the cultural part that sometimes gets in the way, along with other stigmas within the African American community. You're weak. A sign of weakness is mental health is identified. So that's some of the factors that get in the way. Then also knowing that in the African American community, we get much, not that any diagnosis is a bad diagnosis, but we get more diagnoses like schizophrenia, bipolar, when it may be just depression. And so we get harsher drugs, we get older drugs in the African American community because of financial differences. So where we may be dependent on Medicaid or different avenues of paying for medication, we may not get the most up-to-date medications. And so we're still being mood disorders and schizophrenia and different diagnoses still being treated with medications that have kind of been more historic than the ones that are now treating these diagnoses. And so if you're a person who gets diagnosed with a mental illness and you start to take medication, these medications are either too harsh, don't treat your symptoms, then it's less likely that you're going to continue with outpatient treatment. And so that's why in the African American community, that's one factor that a lot of people won't continue with the services because they don't like the outcomes of the medication. I'm a zombie, I'm sleeping too much, I'm sleeping too less. So they don't want to treat, they don't want to continue with medication use. And so then outpatient treatment is not something that they do. Then the quality of services in some of our areas, because there are more people in poverty in some areas for African Americans, the treatment is not the best. So if I'm getting treated and it's more about quantity than quality in outpatient mental health, then I don't feel like I'm being heard. It's not the regular, so I'm not going to come in just to sign papers or just to do the bare minimum, and I'm not feeling like what's going on is really being treated appropriately. And even in schools, we have African American children don't always receive counseling, don't always receive the other services that in other schools that kids are introduced at a really young age. So there's some familiarity with mental health, and so African Americans don't always have that. Back to when we talk about African Americans receiving diagnosis, is also African Americans are more likely to have had traumatic events. There's more exposure to trauma. There's more exposure to violence, especially in some of our communities that are socioeconomic at the lower end of the socioeconomic status. And so you are dealing with people who more likely have post-traumatic stress disorder, but that's not what's being treated, and that's not what's being diagnosed. And so there's no change in behavior because you're not treating the actual diagnosis, and then the person feels like nothing's working. My child is still doing this. I'm still dealing with this, because you're not treating what they're actually diagnosed with. Some of those factors come into play. Again, there are laws, Medicaid laws, different things that certain diagnoses accommodate. You have to have certain diagnoses for certain things, and so many people don't get the accurate diagnosis in the African American community. Some people are reluctant to access services because of, sometimes it's easier culturally to talk to people who look like you. And so if I go somewhere and nobody looks like me, nobody culturally has my understanding of where I'm coming from, it can be difficult. And that cultural competencies plays a big role in why African Americans don't continue. And people lacking the understanding, therapists, psychiatrists, lacking that competence of culturally, African Americans are more aggressive. They may communicate differently. We're more expressive, and so I may not be in the episode. I'm just expressing to you my excitement, and so not having that understanding. And there's a lot of studies show that a lot of African Americans report that they felt like they therapists or psychiatrists was being racist, feeling like stigmas are placed on them. I'm just coming in. You just want medication for drugs. You just want medication to sell. So they are more reluctant in some cases because of that. And it's not necessarily that we don't address it. As I said earlier, a lot of African Americans do identify that they have mental health issues. But the fact that the continuation service doesn't continue. We think about in our own families, some of the things that we've seen or heard about African Americans dealing with mental health issues. And sometimes spirituality plays a role in that, as you all talked about earlier, and not dealing with, although it can be an assistance, sometimes is a hindrance in the African American community for people dealing with mental health. Demographics, where I am, where am I located? If I have to go all the way across town, there's nothing in my area. Just like in those areas, we know that a lot of African American areas aren't populated with grocery stores. They just like grocery stores, they aren't populated with appropriate mental health services, and adequate treatment from those places.
So I have a question. Okay. Just, Ms. Fogle, listening to what you're saying, I know a lot of times people like to say that black people don't like getting treatment. But based on what you're saying, it's hard to get treatment or to focus on treatment if I'm worried about where I'm going to eat or where I'm going to... Okay.
Where you going to eat, where you going to sleep, do you have food for your children, you don't have income, do you have transportation? And then, like I said, sometimes we'll say, well, the city supplies all these services, but are the services adequate? Do they meet a standard? We know that sometimes you say, okay, well, you can get transportation, Medicaid pays for transportation, yeah, and I have to wait 3 hours for that transportation. So me, the person who's dealing with a mood disorder, who's dealing with irritability, I'm not doing that. So because of the quality of service, a lot of times people don't address it and stay engaged long enough to really address the mental health issues because of other social factors that may be going on in their lives.
Because I know one of the things when we talk about black people, African American people, when we think about all the things that we've gone through, the things that we're still going through, it's not a matter of us, still making excuses. It's about the fact what the data research shows us that we're still struggling in a lot of different areas.
Mm-hmm.
But despite the fact that we're struggling, there are a lot of protective factors that kind of contribute to us doing so well. Because despite the fact that my son is in jail, this is going on, I don't all of these problems, I still have those protective factors that kind of keep me going. And just a few of those protective factors: religion, spirituality, racial pride, resourcefulness, family, strong desire for education, community involvement. These are some things that are protective, meaning that these are things that when we talk about protective factors, are characteristics associated with a lower likelihood of negative outcomes or that reduce a risk factor's impact.
Yeah.
So I may have grown up in, I don't know, people like to say Southeast or Cabrini Green. If you're in Chicago, that's a bad, no, Cabrini Green was in, Chicago, or Red Hook in New York, and real bad projects, or in a trailer park in the country where I'm from. You may have grown up in that area. Everybody in your area went to jail. Everybody in your area may have a mental illness. Everybody has all of this stuff going on with them. But then you find out there's like one person, right? And that one person, because they had a supportive person, because somebody said you can make it, because they went to church. So those are like protective factors. Can you speak to maybe how those protective factors can keep a person from dealing with trauma better, or dealing with certain illnesses better?
A protective factor, especially in the African American community, in some communities, African American communities, there's a sense of togetherness. I'm not alone, I'm supported. And so when it is that, although we talk about the separation of crab in the barrel effect, there is a lot of community in the African American community where I'm not feeling alone. And some people having strong family ties. I know, me personally, I did grow up in Southeast and have experienced a lot of witness to a lot of traumatic violence and different things, but the family structure was very important in being a protective factor where things may have affected somebody else different who went through those same things and same scenarios. It didn't, because I had a mother who raised me and steered me in the way that she did. So those protective factors are really important. And then kids are social learners. So in the African American community, some people watch their parents and see, when my mother was stressed out, I seen my aunts come over and come get us. I seen my uncles come bring her money. I seen the family. So we learn behaviors and how to protect ourselves so that we don't have to go through some of the same things. And being a support factor and very important in our community, African American community, where you feel like you're not alone. It helps out a whole lot for protecting against some of those things. And some of the things, the factors why people stress is a major component in mental health, major trigger for mental health. So with those protective factors alleviating stress, it is less likely that you will have negative impacts from mental illness.
All right. Because like I said, family members can, I think we were talking about earlier, at the earlier panel, the importance of relationship. How did you say that? Relationship and sharing information. Am I saying it right? Okay. How important that is. And that's a protective factor as well.
Yeah, that relationship, and even the communication factor. My mom talked on the phone, not realizing, now that I think about it, growing up, she talked to her sisters and her first cousins so much, and they was like, "Mom, you stay on the phone." But not realizing she was having counseling, not realizing that she was alleviating stress, and that they were doing the same thing. So when we think about some of those cultural things in the African American community, they were impactful in being protective factors for us.
And especially, especially when we talk about the mental health piece, because because all cultures deal with stigma, right?
Yeah.
It's just that because we have the other issues more so, dealing with how we're going to eat. There's a more, you can say there's a lot, we're slower, if you will, maybe a little more, I don't say more stigma, but it's taken us a little longer to really realize certain things, if I can say it that way. But even as we realize and we start taking on more information and integrating more into the larger community as it relates to data about mental health and all that stuff and getting treatment, I don't think we need to lose that protective factor.
No.
Right? Because that is what has helped us. You know, we may not have known, like you said, your aunt may not have known she was doing therapy, but she was doing therapy. You know, so yeah, there are a lot of things in all communities that we have to work on. All communities have physical abuse, sexual abuse, and no one community has more than the other. But the thing is, I think African Americans, that resiliency, we have the ability to keep going.
Yeah.
We just got to realize, okay, at some point, just like we're not energizing bunnies either.
Right.
Exactly.
That's right. That's right.
Right?
That's right. Absolutely. And we, that goes back to knowing our limits. Okay, a lot of times we don't know our limits because of the perseverance. Okay, and feeling like I don't know where I would be if I stopped. So I've got to keep going in this direction for my safety's sake. And it may be farther than we need to, in some situations.
And I like that word that when you use the word safety, because for a lot of African Americans, we don't feel safe in America.
That's right.
I'm just saying that, just to be honest, you don't feel safe. You don't know. In this area, for those of us, people who are listening to us, we're in the Washington, D.C. area, so it's a city area. But there are certain other cities that I've gone to that kind of remind me of the South in 2019 looked better than some of these cities look now in 2019.
Yeah.
I mean, you go, and I don't want to offend anybody, so I won't name any places, but you go to some of these cities, it looks like a war zone, right? So you got people who don't feel safe. You have Flint, Michigan. Is it Flint? Still don't have clean water.
That's right. That's right.
All right. So you still don't have clean water. You still got kids living in lead-infested places. You got to deal with the crime. You got to deal with the court system. You have to deal with police, et cetera, et cetera. So if you don't feel safe, it's hard for me to be comfortable in the therapy session.
Absolutely.
In certain environments.
And since you mentioned the therapy, one of the things that both of them mentioned was being misdiagnosed. Okay, so if I'm not safe in these areas, then why would I want to move out into any of the medical stuff, for therapy? Because I don't know what they're going to do to me when I get there. You understand what I'm saying? And I remember when I used to have severe migraine headaches. This particular time I had one so bad that my dear friend of mine took me to the hospital, and they insisted that I had to be on drugs. I could hear them talking, but their words were like they were bouncing off my head. I couldn't respond to them. So they insisted that I must have been strung out on something. And it wasn't until they did the test, even though she said, no, she's never used drugs. I could see their faces and back and forwards, but I couldn't comprehend what they were saying. So someone told me later, said, you okay? I said, well, she said, yeah, I saw you at the hospital. You look like you was way strung out. I said, no, I was having migraine headaches. But they were insisting that I had OD.
Well, but African Americans don't get migraine headaches. You people, quote unquote, you use drugs. You overdose on drugs.
That's the bias.
And that's what I'm talking about. See, misdiagnosed and stigma. And it wasn't until after they did the urine and all that stuff to find out, no, I hadn't taken anything at all. Okay, so they still didn't know what to do. And when I went another time to the hospital, and when I left, and I went to the neurologist the next day, and he asked me, what did they give me? And so the meds that they gave me, he said, you didn't take them, did you? I said, no, for some reason I could not. He said, I'm glad you didn't. It was dilithium phenobarbital. He said, this would have expanded the brain, the veins in my head and caused, he said, it could have killed you. Still, you see what I'm saying? So, and I had insurance, y'all, okay? So if I feel that way and I had insurance, what about those that, that's on Medicaid or stuff or don't have any? And if you're on Medicaid, that doesn't mean they're going to give you the best. They give you enough to get you by.
About numbers.
Yes.
Yeah, and I think I think about somebody you mentioned how a lot of times we're misdiagnosed. Everybody said that
Yes.
how you're misdiagnosed because sometimes when we go in really our symptoms are really severe. Things have gotten so bad.
Yes.
So now that
Yes.
we're in there,
Yes.
but then also you're talking to someone who's not familiar culturally, kind of with what's going on and what you're saying. She's saying she feels like something's crawling up and down her skin, or she feels like she's talking to people, or just maybe some things that we may say culturally, and it's she has schizophrenia. No, she just has major depression. She's depressed. What is it that black people had to be depressed about, right? That's what you think about,
Yeah.
and not really realizing this person she's depressed just like you're depressed,
Exactly.
right? So again, I think we have to stand up for each other and say no. It can be depression. It can be other things as well. And then also when we go, we have to be clear to the doctor and say, hey, no, I'm not on drugs. No, this is what I need.
Right.
These medications aren't working. I need to try something different. We got to be
Persistent.
forceful. Well, persistent. Thank you. Please.
I always say too, when you initially go to the doctor, I think sometimes, I know the HIPAA laws, you need an advocate. Because when your mind is bogged down and they're asking you, what's the average initial appointment is about an hour. When you bog down and your mind is foggy, you really can't answer those questions. So you really need to have someone that's kind of seen what you're going through a little bit, because sometimes that's why, because mine was major depression, and they put me on an antidepressant, and then I fell back. She's like, okay, you don't have depression. I'm like, wow, thank you for setting me up like this. But that's why it's so important. I always tell people, try to have an advocate, because it's about 100 questions they go down, and you don't know. You don't know.
And depending on the clinician you get, if you come in and then fill out all of the paperwork, or you barely ask a question, patient is guarded. Right?
Yeah.
Right. She's guarded. Well, you don't feel like answering all these questions.
Right. That's right.
I'm tired. I just want the medication.
Right.
And then now you're like, patient is medication seeking.
Yeah, and that's exactly
I just want the medication. I mean, if you say it can help me, this is what I need.
Right.
But then when you think about some of our African American communities, especially those who have been oppressed, they have a thinking that everybody who's in a professional status knows more than me. So they just take that as this is what it is. He says it's schizophrenia, then I got schizophrenia. He says I need to take this medication, then this is the medication I need to take, and not looking further into it. And so that's why, again, like you just said, advocates are very important, because people will feel oppressed. Anybody that knows more than me, I don't know anything. So we feel uneducated and feel hopeless. And so we'll take whatever is given to us and say, hopefully this works. But a lot of times it doesn't. And like you said, could make you worse, could make you fall back. And now what you came in for was one thing, and now things have worsened for you because of the lack of getting appropriate treatment.
Yeah, that's a big thing, because if you are depressed, if you actually have bipolar and you're given medications, there's a certain type of medication just for depression can cause you to cycle, right? And then there are certain medications that can cause you to be depressed. So I think we have to realize everybody's an expert about what's going on with them. Right? I may not have the right verbiage, and that's what I tell people. You don't have to go in and say, I am having delusional hallucinations or persecutory symptoms of blase. Look, this is how I'm feeling. I know I shouldn't be feeling this way, but this is how I'm feeling. I need some help. Okay, and it's just to become straight out with it, and unfortunately, sometimes it may be a trial and error with the medication, but you need a doctor or somebody that's going to say that. Right? Okay, let's give it a try, because we know with depression, for example, medications take longer to work than it does with some of the schizophrenia or psychosis, right? But if you don't know that, going back to what you were saying, having an advocate, if you don't know that, you'll stop too soon.
Right. People stop.
Too soon.
And I think also because of the environment and communities that African Americans are more likely to be in, a lot of professionals who have biases and preconceived notions based off of what they assume. And so like studies say that African Americans are more likely to report, and even teenagers are more likely to, African American teenagers are more likely to report suicidal thoughts, but they're less likely to commit suicide. However, that shows that they are communicating it, but is it being addressed? No, you're not depressed, you just need some money. So that need is being met, but that person is still dealing with depression now that they have the money. So it's minimized in the African American community, not only by the people who are experiencing it, but the health professionals who are there to treat them.
Because I think I see it as being really, it's really being so simple, right? I don't realize, I'm depressed, but I also have money needs as well, right? So, well, we'll just give her the money and she'll be fine. Now realizing that I'm actually clinically depressed.
Yeah, exactly.
I'm actually clinically depressed. Also, when you talk about calling the police, right? We have to be so careful how we call the police. Like Minister Al-Nisi was saying, if you can call a crisis team, that's almost better. But we know anytime you have to call the police, you're talking about an African American person. Going back to your safety piece, you got to be careful. You know, you have to stress this is a medical emergency. You know, you almost got to. People hate to do it, so people wait until things get bad because I don't want to call the police. So while this person is getting worse and worse and worse in the house, until you finally have to call the police, and then you just hope for the best.
Right.
And then, like you said, even with the police being called, those police really being educated on culture, because it may be somebody who may not necessarily need to be hospitalized, because we notice in the African American community there are a lot of more hospitalizations for mental health. So no, you severe, you got to go to the hospital. When it's no, I just need treatment, because we got to think about things. We as African, you can see that I'm doing right now, especially in this area, DC, where I'm from. We talk about hands a lot, so I'm not being aggressive. I don't want to fight you, but as I'm explaining, I'm expressive. I express with every part of my body, and so sometimes factors like that, cultural things that we do, impact that. Oh no, he's being aggressive, or she's being aggressive. She needs handcuffs. No, I'm just telling you the story and how it happened. But it's easy to do that, and then now take you to inpatient. And sometimes it's not, or jail, because you're being violent, and it's not that I was being violent, or I may be violent, but because I have mental health, not just because I want to be violent. So training is really important.
And that's why it's so important. Like again, us people sharing information with what they know. Number one, you don't want to be afraid to get your loved one help if they need to get help. You don't want to wait until it gets too bad, right? But you also want to be mindful what to say if you do have to call. Of course, try the crisis team first. If you have to call the police, okay, you could ask for a trained police officer. If they have it, they may or may not send that person, but at least you can ask. And when the police comes, you can explain, okay, hey, this is a mental health emergency. This is not a criminal emergency or anything like that. Sometimes it helps, sometimes it doesn't.
But I think it does help, because as I'm thinking about what you're saying, I'm thinking about how receiving calls and hearing people say family not being educated on mental health and how to use the right verbiage and communicate appropriately. So they may say things that are triggering the police to come with aggression because of what you said. He's in here going off, and they don't know how to really communicate what's happening. And so they're met with that aggression and that. So now they're looked at as more criminal than somebody who's in a health crisis and needs to be assisted. I think that's a good point, because a lot of times it's family members, and we're gonna talk about family members while you ladies are up there. But as we talk about family members or friends, you don't necessarily. You're nervous yourself. You're in a crisis at that moment, and you're just saying anything, not realizing. The police, they don't know your loved one. The only thing they know is what you're telling them. So you're right. I mean, we've had to call, and I've had to say, okay, we just want to get the person to the hospital, a medical emergency. You have the 3 police cars show up. You have the ambulance show up. One time we had a little fire truck. We don't need all of this, right? So it can be nerve-wracking when you have all of that. But as family members, you need to know kind of what to say. You need to kind of, as much as possible,
not over sensationalize stuff,
Mm-hmm.
right? Because the police don't know.
But see, and then it goes back because then in some African American communities they have to, because that's the only way that they're
They
going to
know.
get supported.
Mhm.
They know that nobody's coming. It's been 2 hours now.
Mhm.
So in some cases, it's like, what do I do? Because if I call and say minimum, then they're not coming,
Right.
or they're gonna take forever. And if I call and say more, they're gonna send more, and then them sending more and doing more causes not only causes for that person to sometimes be embarrassed, to be reluctant to continue with help, increase some symptoms and behaviors against their family members for seeking help for them.
In that area, I do want to say this as well, that when we have called the authorities for them to come, staying calm as much as possible is very important. Okay, I had to call my dad was unresponsive. I'd given him some medicine the night before, and it was supposed to be a 24-hour thing that he took. Well, when I check him at 7:30 in the morning, he's taking it again. We're talking about somebody 89 years old. So when I called him and told him, and like you said, the police showed up, 3 or 4 police cars. They had about 12 police out there, the ambulance and whatever, the fire rescue. So this police has already asked me this question. And so this one comes back and they ask me some of the same questions, a little different than what the other. I said, well, he just asked me those questions. He said, I know, but we have to ask you again. And I look up, here comes some more police into the house. They're asking me the same questions that these other two didn't ask, but then they asked different. Now, I could have gotten that. Well, you keep asking me for, just get him out of, But I had to stay calm and talk to him. After I got to the hospital with him, then here comes another police officer and the doctors and the 3 different doctors asking. I said, well, aren't you all making records of what I've said? I said, because 2 other doctors have already asked me the same thing. Okay? So if that's what's going on, and then you're there for your family member, and you're getting defensive and upset because you don't know, they think you didn't, that's your fault or whatever, you can make the situation worse, or you can calm it down and have it be a little better by how we respond. So I want to say that as well, for the family member, work at as much as possible, as you verbalize what's going on, but staying calm, because we can get to holler, I said, and now all of a sudden now you're the aggressive one, and then they're carting you off, and your family members left there. So all of these things can happen, especially in the African American community.
And also always advise, don't take them yourself. A lot of people say, well, I'll just transport them to the hospital. That's not a good thing when they're in crisis, because I've heard where people jump out the car and take the steering wheel, and I've heard some stories. So you really have to be careful about that.
And that's a good point to make, because I always tell people too, if the police do transport, they are going to handcuff your loved one. With maybe, let me just say that, I would say 95% of the time. Maybe certain parts of the country they don't do it, but they do handcuff. I've seen them handcuff a little old lady, because in their mind it's a safety concern.
Yes.
Right?
Yes.
They don't know your loved one because of that. People could jump out the window and then they're liable, or the person can hit the police officer, and or whatever the case is. So if you do have to call, and they do have to transport, it can be scary, especially for a loved one. I had it was a grandmother, we had to call for her son. Her son, they sent a nice police officer. He was trained, a mental health person. He was talking to whatever, but the kid wouldn't take his hands out of his pocket. And after he was asked him several times, I need you to take your hands out your pocket, take your hands out your pocket. He wouldn't do it. The young man kept pacing, was pacing. Well, okay, after a period of time, that nice mental health trained police officer had to do what police officers do. And another one, they wound up having to take him down and kind of getting his hands out, and I think he had like a little nail. But his grandmother was just so distraught and was so upset, and we really had to kind of pull her to the side, kind of get her to calm down. This is what they have to do. They don't know your loved one. Right? So we can't take it personally. You can't, I think, especially since we're talking about African Americans in general, just because 2 white police officers show up, you can't think it's always racial.
Right, that's right. That's
right? Because we have to realize, okay, it's about safety. It's about your safety, their safety. Anything could happen. right? I always say too that, like Nisi was saying, definitely don't hesitate to call. But keep in mind, if you're calling the police or calling a crisis team, you're calling because what you've been doing had been working.
Absolutely.
Right? You need some help. So when the help comes, you may need to let the help do what they need to do.
And one of the other things even in that area is, unfortunately, we don't always have the family and friend support that we need in going through these things. You know, they don't want to be bothered. They don't this, they don't that. Okay, and a situation where I had to call and get an EP for a family member, and some of the family members was upset with me. Okay, some said they were glad that I had called because they could see that something was going on. All right, and I turned the other ones, they're upset, and they're going to come get them, and they're going to do this and this and this and that. I said, but the fact remains is we need to get them the help right now. Okay, so they're not there to do what they need to do. They haven't been there to be a support, but then they don't like the idea that you're handling it either. I mean, they're glad later, but look at the issues that they're causing before we get to that point.
Okay, so I think, if there are no questions more, we were talking about the African Americans and why people don't get help. Because one of just my pet peeve, I hate it more and more, maybe because I'm getting closer to 85, that is getting, it kind of bothers and rubs me the wrong way. I hate it when people say, other black people will say this, black people, they're just so stupid. They don't know anything about mental health. And I'm like, you know, how we put each other down and not really realizing that it's not that, we can all use more information. Right? We can do a better job for sure. We still deal with stigma, but all of those things everybody else does too. It's just taking us longer because we have so many other things to deal with.
And you know, it's so interesting. You know, that would be something that you would say, because like I told you with my sister, I called, and once she got the help and got involved and whatever, thank God she was able to go on. There were a couple others, but one of the other siblings, she called me, the one that I had went to find the suicide situation. And she said, "Sis, I don't know what to do." I said, "What are you talking about?" She said, "One of our other siblings called and said, why didn't I call them? That they would have handled it different than what I did. As I said before, there were some young children in the home. And if she didn't agree to go to the hospital, then that would have been charges against her for reckless endangerment." Okay? She agreed. So what she did, she was looking for help. Okay? So that left the children having to be put somewhere while she was in the hospital, you know. So the other sibling says, well, you should have called me. I would have handled it different. I said, you don't have to deal with that. Why even call her if she's the one that's been going through with this, okay? And so I said, don't worry about it. Tell them if they have any questions, call me, since I did it, and I'll deal with it. I did what was necessary to save your life. And if they're not satisfied with that, they need to deal with me. But this is how, you know, talking about family members and not having the support, the criticisms and stuff that you got when you've done what was needed to be done, when they weren't doing anything. Let's call it like it is, okay? So, you know, we need to learn how to be a support for one another, okay? And not wait till stuff gets to the extreme and then got all this other stuff to say, you know. Where are you when the situation's going on before it even gets to this point?
And I think that's a good segue into our next topic. We'll mix it up a little bit. We can talk about family and mental illness, and then we can do in your own words, okay? What I have here, and you give me some comments. These are some of the things when we talk about family and mental illness, things that sometimes family members have to deal with, especially at the beginning, maybe the middle stages or the end. For some families, isolation, shame. Okay, you can start with denial.
Denial, definitely denial. Okay. Rejection, refusal of help. You know, a lot of those things. Go ahead. I'm sorry.
I think that denial has a big impact, because when we think about younger children who may be going through depression, and that depression triggers other things and goes deeper because mom doesn't want to address it because she's embarrassed.
Mm-hmm.
But yet I'm going through whatever I'm going through. Or dad doesn't want to address it because he's embarrassed. And so that denial can be detrimental to a family member receiving the appropriate help that they should receive because of your own internal lack of understanding or stigma, belief, or whatever it may be that has hindered you from seeking appropriate help for your child, your children, or your loved ones. No, not my daughter. She okay. Not my son. He's okay. He's fine. He'll get better. And then having a mentality of not realizing that people are individual. So what you were able to manage may not be what somebody else can manage. Or what's present in one person. Well, my sister went through that. She ain't had no depression. That was your sister. And this is another individual. So family, that denial can be a real hindrance and a trigger for increased symptoms. And those symptoms and behaviors turning from one thing to another if gone untreated.
And I just wanted to, I know we're going to move forward with this, but you made a good point. Many times, let's just say we talk about a child, right? A parent, child relationship. Sometimes parents don't realize we get used to our loved ones' behaviors, right? We get used to our children, right? It's not until our loved one or children maybe join the military or go away to college that they start having challenges, and then we want to blame it on the fact that it was college, it was the military, or it was
just regular elementary school.
Right, or
all
the
the
school.
kids in that class.
Right, exactly. No, not realizing, you talk about the stress vulnerability model. That means that everybody was fine. I had a vulnerability. I was vulnerable. But it wasn't until that right stressor came about that you begin to see the problem. So now that I'm in college and I don't have Aunt Alnicia to call me, or Janine to do this for me, and now I got all the stressors that you start seeing it. And how many times we see kids go away to college, they have a break, the family thinks there's something wrong, they're in denial, they bring the kid back, right? And then because no, he's fine, he just needs to take medication, they try to take the kid back to school too soon, and it doesn't work out.
That's right.
Okay? Because it's that denial piece. So it's important to understand that as a family member, as a parent, you didn't do anything wrong.
Yeah.
Right? You wouldn't blame yourself if your kid had a cold or any other type of disease. I mean, sadly, we get sick. The brain, as we talked about earlier, gets sick, just like any other organ, right? But yeah, it is embarrassing as a family member, especially when we try to hide it because of shame and embarrassment.
Yes.
Yeah. There was a lady, and this was a while ago. Her son had committed a mass murder. I can't remember, whatever. But she had quit her job. Evidently, she knew something was going on with her son because she had quit her job, and she had. It seemed like she was living always like a little hermit, like she was really holding on to him. She knew something was going on with him. But rather than, I guess she figured she would handle herself, and she couldn't. And sometimes parents feel that way. I'll just try to handle it. And sometimes you can't. Because your kid is going to go to school. Your kid is going to deal with other people. You have to get them help. But you have that shame. Another thing here is loss. When I was talking about, I'm thinking about one particular kid who went away to college. He was his parents' only child. He was bright, right? He was a real smart kid, according to the parents. And the school he went to, right?
Yeah.
They had to deal with the fact, in their mind, that this kid would never be what they thought he would be. Because they, maybe sent him to school back too early, et cetera, et cetera. But they had to deal with that. That was a loss for them. Because this is my only child. You think, oh my God, he'll never be the doctor I want him to be. Not really understanding, well, no, give it a break. Give it a minute. There's a recovery process. Let's see what happens with the right medication. But people just think it's all over.
Yeah.
Poor treatment services. A big thing with family and mental illness, challenges to own physical and mental health. Right?
I was just thinking burnout for a lot of caregivers, dealing with, working especially in the community, and working with people who have children and adult children who suffer from severe mental illness and persistent mental illness. And I just been dealing with it at home, and this person is delusional, suffering from hallucinations and behaviors that are a hindrance to me, but I'm burning myself out, and sometimes they end up in services because of being a caregiver and not taking care of themselves and not dealing with or managing stress appropriately, and not knowing that there's resources for support in the community, some services like respite or different things where they can get some support for their family members, or knowing, hey, I might need to put my family member in a group home. I can't do it all. I can visit every day. I can come over, but in the home, I can't manage. I can't manage their safety or mine because of their behaviors. So, not internalizing things that you may have to do as a family member to help your family who's dealing with mental health, and taking it all for yourself, and not even back to the pride and humility. Be humble and don't be prideful. I can handle it. I'm managing it. Seek help and support.
Because again, how many times we've known, I think I was talking about somebody yesterday, maybe you and I, talking about a family member where they had several sick children, that needed extra help. They wouldn't put the one child in the home. That sounds so bad. Well, the child was beating the parents up, and then the father died suddenly. And when the father died suddenly, they had to make some changes. What happens if you're not around? There's an old, which I think she's deceased now, but she was one of the founding members of NAMI, and I have one of her books. And one of the things she taught, she used to say, "Hey, you have to think about it. What happens if you're not around? You know, and that's a simple question. People don't think about it. What happens if I could drop dead, today, tomorrow, and what is your loved one going to do? Do they know how to take their medications? Do they know where to go? Do they know who to call, et cetera, et cetera? Because you can't do everything.
Yeah, and limiting that isolation, because you have some people who say, hey, my daughter suffers from this, and it's just me and her. I'm not introducing her to nothing else or no one else. And then when their separation comes, there's a bigger issue for this person who's attached to the parent and not able to make connections or receive assistance because you've isolated them from getting any other support.
And I think it's so important as family members, especially as parents, if you have other children, you have to pay attention to the other children. Because other children, believe it or not, find out no more than the parents do. Right? They're the ones because they're the ones that sleep with their, they share rooms and all that stuff. They're the ones that sometimes are a little more realistic about their brothers or sisters' diagnoses or prognosis around what's going on. But you can't put so much into the one child that you forget that you got another one.
That's right.
It kind of has to be that. One of the big things, we talk about problems that as a family member, we talk about burnout, just the negative social stigma, especially if you're talking about severe and persistent mental illnesses, say for example like schizophrenia, where your loved one may be unmedicated, right? And they're unmedicated, they're knocking on people's door. They're unmedicated, they're becoming a nuisance, if you will. And people looking at you, what is wrong with her? What kind of family is that? All of these things you got to deal with, right? But you have to be able to have a comeback for it. Well, what kind of family is that? Well, a family who has a child with a mental illness. That's just how it goes, right? But it can be embarrassing.
And then it's to gain knowledge, because sometimes it's as you gain knowledge, share that knowledge with your other family members, because it just may be the lack of knowledge, and if they get an understanding, hey, he's not going to be violent or she's not violent, this is what we need to do in case this happens, or if you see this behavior, this is what should be next. But when people have a lack of understanding and they only know from what they see on television of schizophrenia or bipolar or those things, then they assess that this is what's going to happen, and they don't know. So you become educated to educate your other family members who could become a support if they have more knowledge.
What would you say to family members, for both of you? What would you say to family members who are dealing with someone with a mental illness?
One thing I would say was check yourself and your biases. Do an internal review of what you're feeling, what you're thinking, so that you can be supportive. Because you can't be supportive to a family member if you have. I can't be supportive to my cousin or my sister who's bipolar, and she may be, one of her behaviors may be to be sexually impulsive if I just think that she's a hoe and not have an understanding. So check your biases, check your thinking, check your understanding of mental health and what's going on before you try to assist, because you kind of can do more harm than good when you don't have a clear understanding of behaviors. And to love and support, to care for, to communicate, to have relationship. Sometimes we exclude those individuals with mental health. Oh, she depressed, she ain't want to do nothing. I'm not. She don't like to do this. That may be one of the reasons why she's depressed, because she just feels isolated. And so to offer, to communicate, to engage with, to show love, and to even in a mental health setting, if you have to go with them to appointment, to let them know that they're not alone. Whatever you can do as support, be supportive, and then know yourself and seek help and have stress relief for yourself as well.
Well, it takes a lot of patience, a lot of perseverance, compassion. Recognize that instead it could be you instead of them, and how would you want to be treated in a situation such as that. And keeping that in mind, then you're not going to be so quick to jump all over them, and attack them about every little thing that you see that's going on with them. As she said, keep the line of communications open. I had the issue where I had someone tell me, they says, I hear voices. I said, really? What are they saying? Okay, and I actually had them talk to me about it, I couldn't say, oh, you just, you understand what I'm saying? I couldn't jump all over them. You just acting crazy. You don't know, No, that's not a time for all of that kind of stuff, okay? Learn to get beyond the embarrassment, because they can embarrass you a lot, but you got to learn how to get beyond that part and recognize that this is what's going on, okay? Have a support group, of course, all right? And in some cases, you got to get a thick skin. You can't wear your feelings on your shoulders, because you're going to hear a lot of comments of people that are not knowledgeable of what's going on and their attitude and their diagnosis about it. Because if you don't have one, then you're not on the embarrassment. Now you're to the point where you're wondering, how much of it is really me. All these different things can go on. So it's a lot of evaluation going through something such as that.
And I think to piggyback also, not to internalize not only what others are saying, don't internalize from the behaviors that may be presented. Because if your loved one may be going through an episode where they're not as affectionate, they may be going through an episode where they are aggressive in communication. So don't always internalize everything that's happening with their behaviors for yourself.
Yeah. And I can't stress it enough, knowing your limits. I've had to call the EP several times, So, no, I can handle this. That might be the last time you handle anything. You must know your limits.
Well, we thank you.